And good afternoon. I'm Dr. Duke Majan. It's Thursday, February 13th, the day before Valentine's Day 2025. Our patient travels from Miami. Sorry? West Coast of Florida, we'll say. I apologize. And she has two herniated discs, T10-11, 11, 12. Everyone agrees? And we're going to be repairing these two discs. Shot? All right, so shot. That's 12. That's right where her pain is. All right, looks good. Let's go look at the lumbar spine real quick, Jordan. Shot. So we've got 5, 4, 3, 2. Can you pull up just a little bit? Shot. 5, 4, 3, 2, 1. Stay on and go north. 5, 4, 3, 2. All right, show me L1. Come down to L1. Come down to L1. I want to see L1 down to the sacrum. Down lower. Shot. 1, 2, 3, 4, 5. That's 5 vertebrae. You agree?
Yes, sir.
Looks good. All right, let's go back up north. We're going to get started. I'm going to place the needles on the right side, and I'm going to enter the spine from the right. Got to have her a little bit more comfortable than that, Dr. B. All right. Sorry about that. Little numbing medicine. If you have questions, feel free to ask. Shot. Let's go lateral. All right, Henry.
Righty. At this moment, no current questions.
If the audience has questions, they can ask. Otherwise, we're going to be going ahead with accessing these discs.
Copy that. At this moment, no current questions.
Okay. Shot. Dr. B, come on. All right, you're doing great. Shot. Let's go ahead and get an AP. I don't know yet. All right, lateral.
We have a question
Sure.
coming from Royal ViewTube
Shot.
on YouTube,
Mm-hmm.
asking, Doc, what symptoms is this patient feeling?
She has pain, back pain. Shot. In her thoracic spine. That's all. Shot. Shot. AP. All right, lateral. So this is going to be 11, 12. This is the bottom of the two discs. We're going to do this one and the one above. Her spine is quite anterior, quite deep. Shot. Shot. Good. Getting there. Very close. Shot. 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 Perfect. AP. She has back pain right where we're operating. Nothing else. This is coming from a damaged disc, and that's what we're here to fix. Lateral. Let's go, Jordan. It's a quick AP, then a lateral. Don't even wait. And just waiting is wasting time. Let's show the audience the causes of back pain, Henry,
Of course.
because there's about 30. Shot. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Okay, we are in at T11-12. We're trying to get into T10-11. And I'm having to change my trajectory a little bit to get there. Shot. 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 I'm hitting the facet. Shot. So we're not too far off. Shot. And we're very close, but not quite there yet. Shot. The first step is always to place the needles. The needles guide the surgery. Shot. Shot. Almost there. Shot. Give me an AP view. Any questions, feel free to type them up. I'll be happy to ask. You're watching live spine surgery. Again, this young lady has horrific pain coming from her spine at T10-11, 11-12. There's 2 herniated discs with annular tear with inflammation causing her pain. She's here at Duke Spine to have this procedure called the Duke Laser Disc Repair. Shot. All right, let's see if we can't get in. Are you ready, Dr. B? Shot? I'd like to. If at all possible. It should be good. All right. Henry, did we show the audience how a disc injury can be so painful?
Not yet. We most certainly can.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right. Do we show the audience how we fix these?
We most certainly can.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. The advantages with the Duke Laser Disc Repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. We're going to proceed. She's asleep. I was not able to do a discogram, but we can see there's a tear. So these are the two discs we wanted to fix. We're going to go lumbar.
Yes, sir.
We
Num num?
have a couple questions.
Sure.
This next one is coming from Becky on Facebook,
Hi, Becky. Welcome.
asking, following this procedure, how long will she have to be extra careful with everyday life? Is physical therapy needed or recommended afterwards?
There's no therapy. There's nothing she has to do except not lift heavy weights, and no contact sports for a year. No heavy weights or contact sports for 1 year. In 1 year, the disc will be completely healed, and she can go back to doing whatever she wants to do. Shot.
We have another question
Go ahead.
coming from Jacobo45 on YouTube, asking, hi, Dr. Duke, can one strengthen his quadriceps after surgery by isolating it using a machine where you sit and don't carry weights on your shoulders?
Yes. You can use that machine to do quadriceps exercises. You just got to be careful because it still puts a strain on your lower back. Shot. Hold on. Okay. All right, we are inside the disc. The first disc we have to repair. All right.
Oh, we have a couple more questions.
Go ahead.
Next one is coming from Faisal on Facebook, asking, Doctor, I still don't understand how have surgeons can go through all those years of training and experience then not to know where and why pain happens and how to successfully treat it. Are they only trained to decompress nerves that are pinched,
Laser.
causing numbness and weakness? Thank you.
Yeah, that's correct. You are correct. They're only trained to unpinch nerves that are being pinched, causing weakness, numbness, and that's it. Nobody is trained to cure pain. I feel the system needs a complete revision, complete overhaul, but nobody listens to me anyway, so I can't fix a broken system. It's too big and too broken for one person to fix. I barely can get my own business working properly. And people doing what they're supposed to do here, let alone trying to fix all the doctors in the world treating patients' spine problems. All right. Who's next?
Next question is coming from Pawn Lust on YouTube,
All right, Pawn Lust.
asking, since they're often bigger, are bulges harder for you?
No, bulges are easier for me. They're not bigger than a herniation. Herniations are bigger, but bulges is a herniation. Bulge is a herniation. There are 10 names for herniation. Herniated disc, bulging disc, ruptured disc, extruded disc, protruded disc, slip disc, spondylitic disc, sequestered disc. Those are all the same thing. And they're all the same thing, and they all require the same treatment with the laser.
Next question coming from Jacobo45, once more on YouTube, asking, why does the pain increase when you inject the blue dye into the rupture of the disc?
Because the disc is sensitive. It's full of inflammation and it's painful. And if it's not full of inflammation and painful, then it will not be sensitive and it will not increase the pain. Therefore, it's a test to verify that we're treating the right disc, we're treating the right source of pain. It's called a discogram. Unfortunately, if the patient is asleep, we can't do it. And then we don't know if this was causing her pain. We can't confirm it, except to wake her up when she's done and ask her if she still has the same pain.
Next question is coming from Faisal, once more on Facebook.
Okay.
Asking, hence why this is from their follow-up question, hence why they refer people to pain management doctors. Coming back from his question of why doctors just...
You are correct. That's why. If you have a patient with back pain after spine surgery, instead of figuring out what's wrong and fixing it, the surgeons refer the patients to pain management. The pain management doctors can't fix them. All they do are treatments that get them more money, but don't fix the patient.
Next question coming from Rusty on Facebook, asking, if you have a hard time getting into the disc because of the rib and rib joint, will it cause temporary pain in that rib and rib joint area?
No, it doesn't. The procedure never causes pain in the joint. It causes pain in the muscle that we pass through to get to the disc. That's where people get pain. They get a muscle spasm because nobody's used to having a metal pipe stuck in their muscle in their back. Even though it doesn't do any damage, it actually irritates the muscles, so that's where their pain comes from. But it goes away very quickly. Patients' pain from this surgery is gone usually an hour after the surgery. Sometimes a few hours, but generally it's about an hour later and their pain is gone. Great questions. As always, my audience is asking me very good questions. All right, we're almost done.
Next question coming from Faisal, once more on Facebook.
Yes.
Asking, doctor, how many levels in the spine can you treat with the laser? Would you have to do more than one operation due to multi-level issues? Thank you.
Yes, so the most I can do just really depends on how healthy the patient is, how well they breathe while they're asleep, and how long it takes me to do the surgery. But generally, we can usually do about 4 or 5 levels at a time for most patients. All right, we're almost done with this disc. You can see all this scar tissue from chronic inflammation.
We got another question coming from Pawn Lust, once more on YouTube,
Yes, Panlas.
asking, you go through the disc to reach the other side near the spinal cord and roots, right?
No.
Oh, so
We go into the tear. The tear starts at the periphery of the disc and works its way to the inside. We go into the tear and we stay in the tear. We don't go into the disc. We go into the tear.
their follow-up was, does that mean that there's a new annular tear on that side and that has to heal too?
Nope, we don't create any annular tear. We go through an existing annular tear. All right, we're just about finished with the first disc, and we're going to move on to number 2 in a moment. You can see last bits of inflammatory tissue here under the posterior ligament, but this is the end of the tear, the end of the herniation. Right here, the last of it.
Next question coming from Faisal, once more on Facebook, asking, Doctor, do you think one day AI would help your procedure?
Sure. I think it's possible that AI can make people more aware that this procedure exists. I don't think AI will do the procedure better than me, but I think the AI will raise awareness. If you do a Google search, maybe AI will bring up the procedure. And show it to you, instead of other types of procedures that are not good for you.
Next question is coming from Winnie on Facebook, asking, from before, are you able to remove rods and screws from the thoracic spine for T4 through 8 by laser?
No, we cannot remove screws and rods by laser. Laser cannot do that. We have to open the patient up with the same incision they had to put the screws and rods in, a big incision. And that's the only way to get screws and rods out. Big incision.
No current questions, but we do have a comment from Pawn Lust once more on YouTube saying AI would need 1 million Dr. Dukes for training data first.
Yeah, right. Yeah, I mean, I'm not sure how AI could benefit us, except when you do a Google search, it gives you a good search result of, you have back pain, go do the Duke laser disc repair. That's really the best way AI could be useful. Aside from that, I mean, AI is really the ability to mine data and present data. That's all it really is at this point. It just takes data sets and uses probability to present information to the user. All right, move that loop. But the truth is you know, when you first started searching the internet years ago with Google or whatever search engine, Yahoo, there was a limited number of search results, and typically people would exhaust the search results pretty quickly within a few minutes. But now there's so much information out there that there's too many search results for a human being to go through them all. So having a machine go through all the results, then present whatever, using some algorithm, either the most popular or the most read, or I don't know, whatever they use, can help you identify information. But the problem is you're trusting a system to do your research for you rather than you doing it yourself. So how much do you trust them? What are their intentions? Do they really want to help you, or do they want to help themselves? And if they want to help themselves, then are they really going to give you the data that's going to help you, or are they going to give you the data that's helpful to them, right? So you have to ask, can you trust this data? Can you trust the AI? What do you think about cervical? Think we should be okay?
Yeah.
I'm just...
Can we have somebody?
Let's see, shot. Come on, Jordan, give me some more shots. It's just the fascia. Okay, we're almost there.
At this moment, no current questions.
Have you showed all the videos we want to show?
I believe so. Yes. Yes, we have.
Hold on. Hold on.
Yep.
Let me see. Shot. All right, let's take the guide wire out. Shot. Her spine is extremely deep. You know, she's a thin lady. She doesn't have a lot of fat at all, but she has a very anterior spine. Shot. Her spine is very far forward. That's good. And she has a big enough disc that we want to use the bigger scope. I mean, if we use the smaller scope, it may not do a good enough job. So she's kind of in between. She's just a big enough disc to use the bigger scope, but right on the border. The alternative, when patients have a collapsed small disc, we use the smaller scope. There it is. We're inside the disc. You can see the herniation. Grab her.
Yes, we can.
It's very tough, but there's definitely a herniation here. That's the blue thing. And you can see the grabber is not effective at all at removing it. The laser is really the tool that you need to use. All right, any other questions? Because we're almost done.
At this moment, no current questions.
So once again, this patient has been suffering with pain in her back near the bra strap area for how many years? 4 years. She had an injury to the spine that caused a tear in this disc and the one below that we just fixed. The blue stuff is the nuclear material in the center, and through activities, lifting, bending, twisting, she squeezed the blue stuff out into the tear, and that has caused chronic inflammation for the last 4 years. She's been suffering with that inflammation for 4 years, and the pain is debilitating for her. So she found us, talked to me through Zoom, through our free MRI review. I felt that we could do the surgery and get rid of her back pain, if not all of it, at least most of it. And she came here today to have the laser surgery done on these 2 discs. So that's what we're doing right now. We're just about finished. You guys have seen our animation, how the surgery works. Also, why do herniated discs cause so much pain? You've seen that as well. And the truth is, unfortunately, most spine surgeons don't know how to do this kind of surgery, so they can't offer it to the patient to get rid of the patient's pain. But at Duke Spine, this is what we specialize in. We've been doing these types of surgeries for 19 years now, almost 20 years.
We have a question
Yep,
coming from Pawn Lust once more on YouTube,
sure.
asking, 2 questions. Is there a lot of scar tissue since 4 years for her?
Yes, yeah, all this is scar tissue. See the white stuff right there that I'm zapping with the laser? That white stuff is scar tissue. The blue stuff is nucleus pulposus. That's the jelly in the center. And it's bad nucleus. That's why it's turning blue. It's degenerated. Okay? But this is definitely going to be a painful disc. I'm glad we're fixing it.
Pawnless with a follow-up question on YouTube once more, asking how long for there to be a lot of scar tissue?
Scar tissue takes time, usually months, at least 3 months at a minimum, to really see some noticeable scar tissue, and more likely years. So the longer the inflammation's going on and the more inflammation there is, the more scar tissue there's going to be. This is scar tissue. All the white stuff here is scar tissue. You see that? The laser is, remember, that's 1 millimeter glass fiber, 1 millimeter. So everything looks big. It's not big, it's actually very small. The fiber is 1 millimeter. You're looking at a very small place inside the disc. But this is a scar tissue right here, the white stuff. This comes from chronic inflammation. Inflammation going on for years. Imagine having a pimple on your face, red and swollen and tender and painful for 4 years. That's what this is. This is inside the disc though. And it's not infectious, it's just inflammatory. Great questions. Just about done. Another minute or two.
Lastly, from Pawnless once more on YouTube, asking, the body will never naturally heal from scar tissues, I assume.
The scar tissue is your body's attempt to heal. It piles up scar tissue as part of its healing attempt. But no, the disc itself will never heal from the body. That's why people have this pain for 40 years, 50 years. It never goes away because you cannot heal this on your own. That's why you need me to come in here and do this for you. And someday, these other doctors will be doing the same thing I'm doing. But right now, they don't do it because they don't know how to do it. All right, folks. Hope you enjoyed the surgery. We're done. We finished. There's some fat right there and outside the disc. A little bit of inflammation on it. But other than that, we're done. Great job. Thanks for joining us. We'll be back next week.